Good day to all. Welcome to our lecture on responding to emergencies. Okay, so this is one of your or core. Okay, this is one of your core competency for your program caregiving and C2. Okay, so once again, I am your instructor in this unit of competency. I'm Berkian Pugrad, your instructor. Okay, so before we formally start, let me introduce first this unit of competency, responding to emergency. So this unit or this topic covers the knowledge, skills, and attitudes required to respond to emergencies, which includes the aspects of disease control and prevention and emergency measures that can be administered effectively. So the objective of this unit of competency is first is to implement the procedures for infection control and prevention. Second, recognize and respond to signs of potential illness. Third, respond to emergencies and accidents. Fourth, administer medication with guidelines. And the last, respond to threat in situations of danger. So, our topic for this recorded lecture is all about, we will be focusing on objective 1 and 2, which is infection control and the signs of potential illness. Okay, but this lecture highlights primarily one of the important topic, very timely topic, which is all about infection control and prevention. So take note that your microbe is or microorganisms are present are really present in our environment. So microbe is a living thing or living or a microorganism to be particular, that cannot be seen with the naked eye. So this type of your microorganisms can be effectively visualized with the use of microscope. Examples of your microbe or microorganisms, we have your bacteria or virus. Aside from bacteria or virus, you also have your fungi and other forms of parasites. So some microbes are harmless or they are even helpful. So we usually label those harmless and helpful microbes as your good bacteria. Example, we have your probiotics. Okay, so the other term for this helpful microbe are your resident bacteria or your normal flora. Okay, example of your normal flora in our skin, meron tayong mga normal flora in our skin. Okay, meron tayong mga normal flora in our stomach, okay, in our GIT that helps us in digestion. Okay, uh, kapag yung mga mothers, no, yung mga newly born babies, okay, newly born babies are being benefited from the normal flora that they get from their mothers. Okay, most especially during breastfeeding, during skin-to-skin contact, because those normal flora will eventually strengthen the baby's or the newborn's immune system. Okay, so however, there are some microorganisms, no, when those normal flora will travel or will go to the other sections of our body, it will now cause infection. Okay, like for example, we have your E. coli or your Escherichia coli. Your E. coli is a normal flora in our GIT, particularly in our lower gastrointestinal tract. Okay, but if those E. coli will travel and will go to our urethra, okay, pupunta siya sa ating urinary tract, sa ating urinary system, doon na magkakaroon ng infection. Ang tawag na natin doon na yun na tinatawag nilang UTI or urinary tract infection. Okay? So, bakit nga ba nagkakaroon ng mga infection na yun? So, siguro, okay, one of the reasons, like for example, in UTI would be the improper douching or improper perineal care, okay? Or it so happen na very weak ang immune system kaya nagkakaroon ng mga infections. Okay? So those infective or infectious agent rather are termed as your pathogens. So they are your microbe that can cause an illness, or in layman's term, those are your germs. So these are the different types of microbes, their visual representation, and the infections that they cause. So first we have your bacteria. So your bacteria are your single-celled cells or single-celled organisms that are present in our planet. So these bacteria are very vital on the planet's ecosystem. Why? Because one of their function um, is they are the one who kumbaga they digest, no, or they help in the sila yung nagse-serve na taga-kain kumbaga ng mga nabubulok na mga halaman, taga-kain kumbaga ng mga nabubulok na mga hayop. Okay? So they help in the process of decomposition. Okay, that's why they are very vital to the planet's environment. Bakit kapag may mga tinapon tayo ng mapagkain dyan? Okay, for example, merong nahulog na prutas sa mga garden, okay, sa field. Ano mangyayari sa prutas na yun? Eventually, mabubulok. Eventually, it will be decomposed. Eventually, it will become, again, a soil, fertilizer. Why? Bakit nagkakaroon ng ganong mga proseso? Because of the bacteria. Okay? So, those are one of the functions of bacteria. However, aside from that, kapag sobrang dami ang bacteria at napunta sa mga tao, napunta sa host, okay? Napunta sa animals, yun na yun ang problema. Okay? So, on this picture, excuse me, on this picture, we have here the different forms of your bacteria. Usually, bacteria are named based from their morphological structure or based from yung kanilang form. Kung pahaba ba sila, pabilog ba sila, parang capsule shape ba. Okay? So, later on, we will tackle those things. Okay? So, the common infections that a bacteria can cause, we have the urinary tract infection, we have your pulmonary tuberculosis or your TB or PTB, we have your bacterial meningitis, strep throat, no? Yung mga usual na sore throat, no? Tonsillitis, and you also have syphilis. Syphilis is a form of your sexually transmitted infection. Next is your virus. So your virus is a small collection of DNA, no? Small collection of genetic code, either a DNA. DNA stands for deoxyribonucleic acid, or RNA. RNA stands for ribonucleic acid. So those are structures of a minute living organism. So all cells, like bacteria, have their DNA. Human cell, no, they have their own DNA. And RNA as well. But your virus only contains DNA or a RNA. So those type of virus or this virus are being surrounded by a protective coating, which is called protein coating rather. And the difference between bacteria and virus is your virus cannot replicate or cannot replicate, cannot live without hosts. So they need to infect a host, they need to infect healthy cells, and then they reproduce out of that healthy cells rather, and they make copies of themselves para sila ay dumami at mabuhay. Okay? So examples of your virus, of course, alam na natin yan. We have your SARS-CoV-2, the causative agent of coronavirus. Okay? Coronavirus in general is a broad family of viruses. Okay? Na maraming klase yan. Like for example, your novel coronavirus or your COVID-19, this is a new type of virus that emerged from the family of coronavirus. So other forms, other infections that a virus can cause could be HIV, AIDS, hepatitis, okay, flu, or the common colds. Okay, of course, we have also SARS. So next, we have your fungi. Your fungi is a eukaryotic organism that digests food externally and absorbs nutrient directly through its walls. So, sa other field, no, example ng mga fungus or fungi is yung oong, okay, or the mushroom. Okay, however, of course, this iba naman yung type ng fungus na nakaka-infect kaysa pwedeng kainin. Okay, so kapag may napansin tayo na sa mukha natin, okay, sa mukha ng mga patient natin na parang may mga puti-puti dito. Okay, in Ilocos, we term this as your kamanaw. So kamanaw is a form of fungal infection. Okay, so kamanaw is a form of fungal infection. Aside from kamanaw, we also have here your oral thrush, no? We also have here your candidiasis or a vaginal yeast infection. Okay, so these are being caused by a fungal infection. Okay, next you also have your helminths. Your helminths are your parasitic worms. So examples of your parasitic worm, you have your flukes or your trematodes, your tapeworms, or your cestodes, and your roundworms, or your nematodes. Okay, yung mga bulate natin noon, nung bata tayo, kapag meron tayong mga bulate noon. Okay, so those are forms actually, no, of infection at yun yung and yun yung problema. That's yun yung problema sa mga bata. That's why they are very prone to anemia, they are very prone to malnutrition, no? Kasi baka meron silang bulate. Maski kain sila ng kain, kung merong bulate na taga-agaw ng pagkain, taga-agaw ng nutrients. So instead na pupunta sa bata, pupunta sa katawan, napupunta pa sa bulate. Kaya usually yung mga may mga what do you call that? Your anemia, your micronutrient deficiency, yung mga malnourished children, they need to undergo the worming. Kasi baka yung reason kung bakit nagkakaroon sila ng nutritional deficiency is because of parasitic worms or parasitic infection. So take note, no, maski bulate lang yan na naitatae or naisusuka, if worst comes to worst, pwedeng mapunta to, no? Pwedeng mapunta to sa other major organs. Like for example, pwede siyang mapunta sa brain, pwedeng mapunta to sa mata. And those are very deadly. Okay? So aside from those type, you also have your parasites and your protozoa. Your parasites, no, just like your parasitic worm, they live primarily from infecting a host. No? Kapag walang host, okay, wala silang kakapitan, hindi sila mabubuhay. Other examples of your parasites, we have your ticks or your lice, yung mga puto, okay? Yung mga lisa, okay? Those are forms of parasites. And the last is the protozoa. Your protozoa are single-celled organisms or a unicellular eukaryotic organism that have a very complex internal structure and carry out complex metabolic activities. Okay, so pansin nga natin dito sa ating graphical representation, hindi naman siya hugis bacteria, hindi naman siya hugis virus. Okay, although they are a type of cell, it's a celled organism that have a complex structure. So example of your protozoa, we have your malaria and your dysentery. Your malaria is being or the vector of malaria is a mosquito, no? So dysentery, ang sintomas ng dysentery is yung pagtatae ng dugo. Okay, so those are caused by protozoal infections. So in order to have an overview with regards to this type of microorganisms, let's look into the structure of a bacteria, kung paano nga ba yung structure nila. Okay, this is a graphical representation of a bacterial anatomy of a bacteria. So we have your flagella. Your flagella is this the long tail of a bacteria, no? So the purpose of this flagella is to mobilize, no? It's for mobilization actually, para makagalaw, okay, para makapag-swim yung bacteria. You also have your pili, okay, yung mga maliliit na parang galamay, okay? Just like in your flagella, it also helps in mobilization and it helps in attaching, no? Para sila ay makakapit sa body part, okay? Sa body part ng host, they need the pilus or the pili. We also have here your capsule, okay, the protective outer layer. You also have your your plasma membrane, no? Your plasma membranes, the fluid-like structure inside the bacterial cell kung saan nandun nagsuswim yung mga other internal structure of a bacteria. You also have your cytoplasm, your cell wall, your ribosome, your mesosomes, okay? Other other parts such as spores, okay? So, ang bacterial structure parang human cell din siya, okay? They are almost quite similar because they are pareho silang cell actually. No? But the difference is bacteria could be harmful. Okay, lalo-lalo na kapag sila ay napunta sa mga unnecessary parts ng katawan natin. It's supposed to be is dun lang sila sa kanilang normal site. Okay. So, bacteria are named based from their morphological structure. Yung sinabi ko nga kanina. Yung say morphological structure, ito yung kanilang shape. Okay, paano ba yung structure nila? So, like for example, kapag dalawa yan, okay, diplococci. Okay, kapag dalawang spherical, no, dalawang circle-shaped bacteria, okay, ang tawag natin doon, that's your diplococci. Example of your diplococci, we have your Streptococcus pneumoniae, which is a causative agent of pneumonia. Kapag mag-isa lang naman to na single spherical, no, single na circle-shaped bacteria, ang tawag natin diyan is your cocci. Okay, kapag marami sila, sorry, coccus rather. Pero kapag marami sila na single shape bacteria pero hindi magkadikit, magkakalayo, okay, those are your cocci. Okay? Next, okay? Kapag circle shape bacteria na parang grape shape sila, okay, ang tawag natin dito, okay, is example of this rather is your Staphylococcus or your Staphylococcus aureus. Okay? So kapag yung mga parang circle shape pero parang train, no? Parang magkakasunod lang sila, parang train yung shape nila. These are your, it could be your Streptococcus, okay, pyogens. Okay? Kapag sila ay, what do you call this, your apat lang, no? Hindi naman kumpol sila pero konti lang. That's your tetrad. Kapag they are cube shape, they term as your sarcinae, okay, or sarcina, no? If those bacteria are rad shape, okay, rad shape usually are your bacillus or your bacilli, okay. Aside from rad shape, meron din yung mga rad shape na may mga mahabang flagella. Okay? Like for example, we have your Salmonella typhi. Okay? And we also have your spore former, kung saan kapag ito nakat, mabubuo ulit yan. So we also have here your Vibrio. Your Vibrio are your comma-shaped bacteria. Okay? So Vibrio, like examples of your Vibrio bacteria is your Vibrio cholerae. This is a causative agent of a cholera. You also have your Spirilia. Just like your Vibrio, the difference between your Vibrio and your Spirilia is yung Spirilia is mayroong parang konting spiral shape siya. Pero konti lang yung pagkaka-spiral kumbaga. So example, we have your Helicobacter pylori. And on the last, yung sobrang parang meron talaga siyang spiral shape na madami, okay? Na medyo mahaba ng konti, that's your spirochetes, okay? So example of your spirochetes, we have your Treponema pallidum, which is one of the causative agent of the form of your sexually transmitted infection. Okay, so let's move now to your defenses against infection. So how do we prevent ourselves from getting an infection? So, meron tayong types of your defense mechanism. The first one is your non-specific defense mechanism. So, your non-specific defense mechanism is the first line of defense against infection. So example of this is our skin, no? Our mucous membrane, no? Dito sa ating buccal area, sa ating bunganga, yung parang yung parang thin layer of covering dyan, those are examples of your mucus. Okay? So our skin is the largest organ in our body, and they serve as the primary defense against an infection. But the problem is kapag nagkakaroon tayo ng skin breakage, okay? The skin breakage, pumapasok, no? Dito yung nagiging daanan ng infection, ng mga bacteria rather. That's why nagkakaroon ng infection. Another, kapag meron tayong mga wounds or cut, okay, delikado rin yan kasi dito pumapasok yung infection. Pero kapag okay yung integrity ng ating skin, edi effective yung ating first line of defense. Kaya tinatawag siyang non-specific kasi from the word non-specific, its protection is non-specific, no? It could protect you, it could protect, no? It could protect our body from any form of microorganism. Okay. Next is your specific. Okay. Your specific defense mechanism. This is done through the production of antibodies following the exposure to certain pathogens or certain pathogenic microorganism. So, ang isa sa mga importante dito sa ating specific defense mechanism, we have your antibodies. So, what is antibody? Your antibodies are your specialized protein that is being produced by the immune system that helps our body to fight off specific pathogens and preventing infection. So, paano na-produce ang antibody? So, antibodies being produced because of the sensitization of our immune system to antigen. Okay? Ang antigen, okay, antigen, these are structures actually, no? These are structures, no, in the bacteria, okay, or sa mga virus. And this structure are being sent or being sensed, no, are being detected rather by by our immune system. That's why our immune system will produce an antibody to fight, okay, to fight that infection, to fight that virus, to fight that bacteria. Okay? So take note, your antibodies are being produced, no? It's a type of protein that's being produced from the immune system response because of the presence of antigen. Okay? So let's cite an example is the vaccine, no? Yung ating mga vaccine. Okay, the COVID-19 vaccine. The COVID-19 vaccine actually imitates one of the structure of a virus. Like for example, may mga vaccine tayo na ang capsule niya, yung when you say capsule, the capsule of the vaccines, okay, the microscopic content of the vaccine is a capsule of microorganism. It's a capsule of a virus. That's why it copies or it imitates the structure of a virus. Another is some vaccines contains weakened bacteria or weakened virus, no? And kapag yun ay na-inject sa ating katawan, nasa-sense na ngayon ng ating katawan na merong virus sa ating katawan. So, anong gagawin ng katawan natin? Mag-produce siya na ngayon ng antibodies at hahanapin niya yung virus na yun para patayin. Okay? Since may mga na-produce na siyang antibodies, kapag may pumunta ulit na infection, may pumunta ulit na virus sa katawan natin, meron ng readily na panlaban ng katawan natin kasi alam na niya kung anong klaseng virus yon nakuha. So that's how vaccine works. Okay. Aside from the presence of antibodies, we also have your um, phagocytic cells, your phagocytes. Okay, so your phagocytes are one of the component of your white blood cells. Take note, your white blood cell, the function of WBC is to fight infection. Ang isa sa mga ginagawa nila is kinakain niya. Your phagocytic cell it engulfs, no? It engulfs that bacteria. It engulfs that microorganism at kinakain niya. Okay? So just imagine, this is a graphical representation. Just imagine the red circle, there's a bacterial cell, and this is your white blood cell, or this is your phagocytic cell. So anong ginagawa ng phagocytic cell? Lumalangoy-langoy lang yung phagocytic cell sa ating bloodstream, at kapag may nakita siyang bacteria, no? Ang gagawin niya? Pupuntahan niya 'yon, kakainin niya 'yon. Okay, kapag nakain na niya 'yon, then mawawala or mamamatay na yung bacteria. So wala na infection. So those are your specific defense mechanism. They are very specific to forms of foreign, to any form of foreign bodies. Okay? So take note that we also need, no, in caring for our patient, we also need to observe, no, we need to watch out for the different possible signs of infection. Okay, although it does not mean na kapag meron na yung mga sintomas na to, meron na mga signs na to, infection na agad. We need also to observe carefully, okay? And we need also to report, no, such observation to our superiors, because those might indicate a problem, not an infection, but other other health problems of the patient. Okay, so one of the most common signs of infection is fever. Okay, so pero hindi ibig sabihin na kapag may fever ka na, may infection ka na agad. Okay, we also need to do other series of tests, but those are one of the simplest sign, no, basic sign na merong problema yung pasyente. Fever. Bakit nagkakaroon ng fever? Okay, again, that's because of our immune responses, no? Kapag merong foreign body, our immune system will able to detect it, at meron siyang mga gagawin to signal that there is a problem, merong kalaban, merong nakapasok na hindi ko kilala. That's why merong mga fever, no? Kapag merong fever, tumataas ang basic metabolic rate, medyo bumibilis, okay, yung pulse rate, medyo bumibilis ng konti yung respiratory rate, medyo bumibilis yung blood pressure. Okay? Because of infection, because the body is preparing something. Diba? Your immune system is preparing to attack that foreign body. That's why tumataas yung mga vital signs. Okay? Kapag may fever, merong usually pain. Okay? With your difficulty of breathing might be associated to respiratory related infections. Okay? Kapag merong pain, like for example, nasugatan ka, namumula yung sugat na yon, merong redness, merong swelling, merong pain, possible indicative sign of infection. Okay? Kaya pag mga nasugat tayo sa paa, napansin natin namamaga yung paa, no? Namumula yung paa, masakit kapag when you palpate it, no? Masakit yung surrounding area ng sugat, indicative sign na yun ng infection. Another, kapag yung sugat na yun, merong lumalabas na foul smelly discharges, merong when you say foul smelly, kasi lang manalangsing nga nabuyok, okay, nga mumawatan, tiangot na. Okay, so those are sign of infection. Okay, usually kapag meron tayong mga diabetic patient, no, at meron silang diabetic foot, okay, non-healing, no, namumula, tapos merong lumalabas na nana. Kapag naamoy natin yung nana na yun, talagang mabaho, kakaiba. Okay? So, that would really indicate na merong infection. Another is your cloudy urine. Okay, your cloudy urine can be sobrang cloudy urine, no? That will indicative sign of urinary tract infection. Pero kapag hindi naman natin siya ma-visualize with our naked eye, is through microscopes, no? Sa pag-series of tests sa laboratory. Those are it could indicate UTI. Okay? Another is your pain or difficulty during urination, okay, or your dyspareunia. That's the medical term. So these are indicative sign of urinary tract infection. Your diarrhea, most especially kapag foul smelly, no? Foul smelly yung tae, okay? Yung feces na lumabas, okay? It would warrant a sign of infection. Nausea or vomiting, lack of appetite, skin rashes, fatigue, increased confusion or disorientation, okay? Like for example, meningitis, but not all, take note, not all confusion, not all disorientation are are signs of infection. That's why we need also to observe for other signs para ma-determine natin kung infection nga ba or non-infection related. And the last is unusual discharge or drainage from the body. Okay? So these are the different signs that we need to watch out to our resident or to our patient. Kapag meron tayong mga nakita na to, na-observe ng mga ganitong sintomas, we really need to immediately inform our supervisor, no, or the resident physician um, in the healthcare facility or the home care for further investigation or for further evaluation. Okay, medications against infection. So, antibiotics are given to treat bacterial infection, no? Yung ating amoxicillin, kapag meron tayong sugat sa paa, yung amoxicillin na yun, huwag nating ibudbud sa sugat natin. Okay? So that's the usual practice, no, in our community. Dada na sugatin, mga alat ti amoxicillin, loktan na di kapsula, ibudbud na di amoxicillin din ti sugat, hindi kuan kakimbeto yung sugat din na imbagay. Okay? So sabihin na ng patient na yon, effective yung amoxicillin nga ibudbud mo din ti sugat. Okay? So nakutulong siguro but the preparation of that medication is not a topical agent. It should be taken oral. And take note, ang problema kasi sa antibiotics, merong mga misuse of antibiotics. If there's a misuse, no, or yung mga nagsiself-medicate ng antibiotics, doon nagkakaroon ng problema. Kasi yung mga pathogens na supposed to be is um, kayang labanan, no? Yung mga pathogens na supposed to be is kayang labanan ng mga first line na mga antibiotics, yung hindi masyadong malalakas. Ang problema ngayon is hindi na ganun ka-effective yung mga antibiotics na yun. Okay? Kakaroon na tayo ng antibiotics resistance. Okay, that's why kapag yung mga pasyente na admit sa hospital, second line or second generation of antibiotics na agad yung binibigay kasi yung mga basic, no, yung mga first line na antibiotics, hindi na siya ganun ka-effective because of your antibiotics resistance. Okay? And in order to prevent antibiotics resistance, take note, bawal mag-self-medicate. Hindi porket linagnat ka lang, inubo ka lang, mag-take ka na agad ng antibiotics. No. Okay? You should avoid doing self-medication kasi hindi naman natin alam kung ano talaga yung cause ng infection na yun unless you will be subjected for further medical evaluation. Okay? So your antimicrobial agents in general are used to treat your fungal infections and other forms of parasitic infections. And your antiviral agents are used to treat alone viral infections. Okay? Nagtitake ka ng antibiotics, yun pala, viral yung cause. Okay? Nag-take ka ng viral cause, yun pala, bacterial infection yung cause. Okay? So, effective ba yung gamot mo? Of course, hindi na maging effective. So, anong mangyayari? Could be your antibiotics resistance or your antiviral resistance. Okay? Problem doon, instead na yung mga first generation na gamot ang pwedeng ibigay sa pasyente, yung mga mas malakas na kasi hindi na effective yung mga first gen. Okay. So, in order for us to prevent infection, or before we prevent infection, let's learn first how do infection occur. Okay? So, meron tayong tinatawag na chain of infection. So, Your chain infection have several components or elements. So number one, we have your susceptible hosts. Your susceptible hosts are the um, individuals who are very prone to infections. So sino-sino ba yung mga individuals who are very prone to infection? So we have your too young and too old individuals. You have your babies, your children, and your elderly. Aside from the too young and the too old, you also have individuals with weak immune system or your immunocompromised or your immunosuppressed. Example of your immunocompromised or your immunosuppressed, yung mga cancer patients, okay? Yung mga patients who are taking immunosuppressant, okay? Yung mga pasyente, when say patient taking immunosuppressant, kapag yung pasyente natin ay nag-receive siya nag-undergo siya ng organ transplant, example, kidney, lung, heart, no? Other major organs sa transplant, liver transplant, those patients will need to take a lifetime of immunosuppressive agents, okay? Why do they need to take immunosuppressive agent? Kasi merong mga foreign body na napunta sa katawan nila. Yung like for example, heart transplant or liver transplant. Yung liver nila galing sa liver ng ibang tao at hindi yun galing sa katawan nila. That's why their immune system will always sense that as a foreign body kasi hindi yan galing sa atin, hindi yan galing sa katawan natin. Kaya foreign body yan. Yun ang parang mindset ngayon ng ating immune system. And in order to prevent the immune system from attacking that liver na na-transplant sa isang pasyente, that patient needs to take immunosuppressive agents. Okay? So, when say immunosuppressive agent, the immune system is being lowered, their immune system is being tapered down, being tapered, at hindi na siya ganun super active, kumbaga. Okay, that's why those patients have a weak immune system. So, they are considered susceptible hosts. Aside from those patients who underwent transplant, could also be a patient with comorbidities, like for example, hypertension and diabetes. Okay, lalo yung kapag diabetes patient, okay, very weak ang kanilang immune system. You also have your unimmunized individuals against certain infection. They are considered susceptible hosts. So kapag ikaw ay susceptible host, no, madali kang dapuan ng mga infectious agent. Okay, madali kang dapuan ng mga either bacteria, virus, or parasites at ikaw ay possible na sakitin. Okay? Kapag ikaw ay possible sakitin, no, you will be madaling dapuan ng mga infectious agents, you will be a reservoir. Okay, when say reservoir, kumbaga nasa katawan mo na yung infection, no, at ikaw at yung mga infectious agents na yon nagpaparami sa katawan natin. Okay? Tawag natin doon reservoir. Aside from people being reservoir or human beings being reservoir, pwede rin naman ang mga animals, ang mga pet, ang mga wild animals like for example, no, yung pagkain natin ng mga exotic foods, no? Kinakain natin yung bat, yung paniki, yung tuloy nagkaroon tayo ng outbreak, nagkaroon tayo ng pandemic. Okay? So because those wild animals have reservoir, okay, are reservoir of certain microorganism. Okay? At ang problema yon kapag yung infective na paniki, no, is a reservoir, kinain ng tao, no? So instead na yung virus na yun andun lang sa mga paniki rather, anong nangyari ngayon? Napunta na ngayon sa tao. Kaya na-infect na ngayon yung mga tao. Okay? So that's a reservoir. So in order for those microorganisms or infectious agent to from to be released, no, from the reservoir, meron tayong tinatawag na portal of exit. Okay? Like for example, your coronavirus. Okay? Umubo. Okay? Umubo yung pasyente na may COVID. Ano yung portal of exit niya? Lumabas siya ngayon sa bunganga. Lumabas siya ngayon sa ilong. Okay? Sumama yung virus na yun sa droplet, okay? Sa laway ng pasyente. Okay? At lumabas sa ilong, lumabas sa bunganga. Ang tawag natin doon, portal of exit. Aside from the mouth, aside from the nose, portal of exit could be done through cut in the skin, breakage in the skin, no? Ano pa? Sa mga stools natin, sa mga ihi natin. Okay? So kapag lumabas yung bacteria, paano na siya ngayon pumapasok sa kanyang i-attack na pasyente, i-attack na tao? Okay? They need the mode of transmission. Kasi yung mga bacteria natin, hindi naman nila kayang maglakad, okay? Wala naman silang sasakyan para mapunta sa mga i-infect na individual. So they need mode of transmission. So your mode of transmission could be form of direct contact, no? Paghawak ng mga infected utensils, like for example, the patient's eating utensils, no? Ano pa? The patient's gown, the patient's pillow, the patient's handkerchief, no? The patient's towel. Okay? At doon siya nag-i-sneeze. Andun. Napunta na ngayon yung bacteria sa mga soiled objects na yon. Okay, kapag yun, hinawakan mo with the use of your bare hand, pumasok na ngayon sa kamay mo kasi meron ka palang cut sa iyong skin. Okay? Hinawakan mo yung soiled linen, tapos you rub your eyes, you rub your nose without doing hand washing. Ang tawag natin doon is your portal of entry. So, successful na ngayon na pumasok yung infectious agent sa ating katawan. Okay? At kapag yun pumasok sa ating katawan, ikaw na ngayon ay naging susceptible host. Okay? And then the chain or the cycle would continue. Okay, so that's how infection works. Okay, we have your chain of infection from susceptible host where the agent lives, where the microorganism lives, at naging reservoir, doon nagpadami, lumabas siya, portal of exit, pumunta siya sa mga tao through mode of transmission, pumunta sa tao, na-infect yung tao, portal of entry, at naging susceptible host, and the cycle will continue. Okay? So that's the problem. So how infections are transmitted? Okay? So, in your mode of transmission, ito na ngayon, no? So, meron tayong tawag na airborne transmission. We have your direct transmission or your droplet. We have your oral fecal and your bloodborne. So, your airborne transmission occurs when a person cough or sneeze and the airborne pathogens are being released, no, in the atmosphere and it is being suspended in the air. Okay? So the particles are being sprayed in the air and they dry out and remain on the air for a long period of time. Okay? Like for example, umubo. Okay? Umubo ka, at yung nag-release ka ng mga droplet mo napunta sa hangin. Okay? Those droplets contains microorganisms and they are being suspended in the air. Okay? TB patient, masok ka sa kwarto, wala kang face mask. Okay? Anong nangyari na ngayon? Infected na ka na ngayon ng possible TB. Next. Measles. In Iloco, that's your Camuras. In Filipino or Tagalog, that's your Tigdas. Okay? Take note, those are highly infective or infectious diseases, no? Tuberculosis, measles, chickenpox, no? Sobrang nakakahawa yan. That's why kapag mayroon tayong mga pasyente na may TB, may pasyente tayo na may measles or tigdas, okay, meron tayong pasyente na may chickenpox, no? Or tuko in Ilocano or in Iloco. We need to observe airborne precaution because those are infections that can be transmitted through airborne. Okay, so later on we will discuss how to protect ourselves from those type of infection. Next, we have your direct transmission. So your direct transmission, of course, when infection spreads from an infected person and touches an object that the infected person has touched. Example, we have your drinking glass, the bedpan, and your bed linens. Okay? So take note, there are many infections that are spread from one person to another when an infected person touches a infected person. Okay? Like for example, kapag ikaw merong herpes tapos kinis mo, no, kinis mo yung partner mo or kinis mo yung baby. So because of kissing, no, it's a form of your direct transmission. The problem ngayon is infected na yung individual. You also have your conjunctivitis. Okay, that's why if you're handling patient with conjunctivitis, no, yung mga hinahawakan nila, kapag hinahawakan mo rin, you need to wash your hand. Kasi kapag yun napunta, nahawak na unknowingly, no, ipunas mo rin matam, the problem there is you get infected as well. Next, you have your oral fecal transmission. So your oral fecal transmission is a method of transmitting an infection that occurs when a feces containing pathogen contaminate the food or water and it is then consumed by another person. Like for example, nagpunta ka sa CR, okay? Sanay mo hindi gumamit hindi maghugas ng kamay mo and then you prepare the foods, okay? And then you let your patient eat the food that you prepare. Ang problem doon is your oral fecal transmission. So examples of your oral fecal transmission would be hepatitis A, hepatitis E, and other forms of your parasitic infections. Okay, we also have your bloodborne transmission. Your bloodborne transmission your bloodborne pathogens are types of pathogens that can be transmitted to another person through blood and other body fluids. So when say body fluids, these are your blood, no? These are our urine, feces, vomitus. When say vomitus, suka, okay, or yisarwa, okay, saliva or kirkatay, drainage from wound, okay? Whether dugo yan or pus or nana or ano, okay? Sweat, okay? Semen, vaginal discharge, tears, cerebrospinal fluid, amniotic fluid, and your breast milk. This is cerebrospinal fluid, yan yung fluid sa ating spine, no? Sa ating meninges, sa may section ng ating brain, outer layer section of our brain, andun yung mga CSF natin. Okay, so those are considered to be infectious. Okay, you also have your amniotic fluid. Okay, when say amniotic fluid, that's the bag of water. No, it serves as the protective cushion of the fetus inside the uterus and the breast milk. Okay, those are forms of body fluids kung saan pwedeng matransport ang infection because of those body fluids. Okay? So we always, kapag tayo nasa home care, tayo nasa hospital, lahat ng galing sa pasyente considered na infectious. Kapag may dugo, we will do not pick that soil linen na may dugo, use a protective covering. Kasi protective covering sa kamay natin kasi we always consider that as infectious. So, these are other forms, no? You have your needle stick injury, your cuts, no? Splashes on the face or in the eyes. This would lead to infection. So, transmission of bloodborne pathogens may occur in the workplace through a wound drainage, cerebrospinal fluid, amniotic fluid, and breast milk. So, infections that are transmitted this way uh, may include hepatitis B, hepatitis C, D, HIV, and AIDS. Okay? That's why very crucial ang mga to. No? Kapag may mga hawak tayo ng mga patient na merong mga drainage na ganito, merong sugat, dumudugo, okay? We always need to protect ourselves as well. So in order to prevent the transmission of infection, meron tayong tinatawag ngayon na breaking the chain of infection. So how do we break the chain of infection? So in order to remove the susceptible host, no, para tayo hindi maging host ng mga bacteria na yun, ng mga virus na yun, one way of doing, okay, is receiving vaccines. Okay, receiving a vaccine makes a person less get likely the vaccine is effective against it rather. Okay? That's why kapag meron tayong chance, no, to receive the COVID-19 vaccine, we should subject ourselves, no, to vaccination. Okay? Kasi those are proven to be safe, those are proven to be effective, no? We really need to protect ourselves, no, para hindi na kumalat kumbaga yung coronavirus na 'to, 'no, dapat sa atin pa lang, we should start breaking the chain already. We really need, 'no, to break the chain of infection to prevent the transmission, 'no, to prevent this pandemic, to control this pandemic rather. Okay? Because we could not really prevent it kasi andiyan na, eh, 'no. We just need to control it. Okay? Later on, hoping for a hoping for immunity and protection. Okay, so that's how to protect, no? That's how to break the chain of infection under susceptible hosts. Now, paano naman natin siya maalis yung pagiging reservoir? Okay, this can be done through taking right antibiotic, no? And taking and prevent and avoiding unnecessary taking of drugs na hindi naman naresetahan ng mga doktor natin. Okay? So to prevent resistance to forms of antimicrobial agent, we need to be responsible in taking medications. Like for example, kapag sinabi doon sa prescription natin, 7 days or 14 days mong i-take yung antibiotic, hindi porket wala na ka ng fever on the second or third day, sinabi mo sa sarili mo, magaling na ako, hindi ko na kailangan ituloy. Mali yan. Okay, mali yun. Kasi the problem there, baka biglang bumalik yung infection, mas malala pa yung infection. Okay? So how could we break the portal of exit? So we could prevent or we could break this bomb via covering the infected wound. Okay? Covering the wounds of infected individuals. Okay? That is to prevent leaking, prevent the seepage of blood, and preventing the pathogen from leaving the area or leaving the reservoir. How to prevent mode of transmission? This is very crucial, no? Hand washing or hand hygiene is very important. Okay? How could we prevent the portal of entry? Okay? By wearing gloves, no? Wearing our personal protective equipment, okay? Wearing our face mask and our face shield para hindi mapunta yung virus, okay? Or yung infectious agent sa katawan natin. Okay? So that's how to break chain of infection. Okay, since we know now the chain of infection and how to break the chain of infection, let's discuss the healthcare associated infections. So your healthcare associated infections or your hospital acquired infection. Okay, these are infections that the patients or residents get while receiving a treatment in a hospital or other healthcare facility. Other term for your healthcare associated infection could be a nosocomial infection. Okay? So usually this can be nosocomial infections are highly preventable, no? Meron tayong mga pasyente no, pumunta sa ospital, magaling naman, wala naman siyang infection nung pumunta, nung admit siya. Pero because of her length of stay in the hospital, doon siya naka-acquire ng infection. Ang tawag natin doon, nosocomial. Okay, nosocomial infection. So instead na magaling yung pasyente, mas lumala pa yung condition niya kasi nakakuha siya ng infection during her treatment or during his treatment. So in order to prevent this, meron tayong tinatawag na four major methods of infection control. So we have your medical asepsis, your surgical asepsis, your barrier method, and your isolation precaution. So what is medical asepsis? So your medical asepsis is a technique that is used to physically remove or kill the pathogen. So the goal of medical asepsis is to remove the pathogen from the surface, no, from the equipment, and from the hands of the health workers. So this can be achieved through hand washing, using of antiseptic and other disinfectant agent, and heat or sanitation. So under your medical asepsis, we have hand hygiene or hand washing. So your hand hygiene consists of both thoroughly washing your hands using soap and water and the use of alcohol-based hand rubs. Take note, according to the Center for Disease Control in the year 2002, hand washing is still the best method of decontaminating hands, and the consistent use of both methods of hand hygiene is the most important method of preventing the spread of infection. Okay? So, take note, hand washing pa rin. Okay, when you say hand washing, the use of soap and water, no? Use of running water, okay? Kung walang running water, okay na po yung tabo, no? And the use of your germicidal soap. Okay? Take note, in hand washing, dapat merong mechanical kasi kapag walang mechanical motion, no, hindi rin maging effective yung paghuhugas natin ng kamay. So, we have here your four techniques of medical asepsis. We have your sanitation, we have your antisepsis, disinfection, and your sterilization. Your sanitation involves the practice that is associated with basic cleanliness, such as hand washing or hand hygiene, cleaning the eating utensils for our patient, and other surfaces with soap and water, and providing clean linen and clothing to our patient or to our residents. Okay? Yun ay under lahat ng sanitation. Next is your antisepsis. Your antisepsis is the use of mild chemicals, like for example, your rubbing alcohol and your tincture of iodine or your iodine. And the aim of applying those mild chemicals is to kill the microbe or microbes and stops them from growing on this on the part of the body. We also have your disinfection. Your disinfections, the use of your strong chemicals such as a bleach solution to kill the microbes on living objects such as bedpans, urinals, and your overbed tables. Okay? So I think in the in the link of the video that I have uploaded in our Google Classroom, andun yung mga examples natin na sanitation, okay, andun yung examples natin ng disinfection. So next is your sterilization. Your sterilization use a pressurized steam or heat with very strong chemicals to kill microbes or on equipment that will be placed in patients or residents body during such as surgical instrument. So yung mga instrument na ginagamit no sa operating room, yung mga instrument na ginagamit sa pagpapaanak, okay? Yung mga ginagamit to do suturing, no? Kapag tayo ay may malaking sugat at kailangan masapol daitin o saraitin, those instruments, surgical procedures underwent sterilization, no? With the use of autoclave, no? Kung hindi man autoclave, like for example, kasi yung mga scissors, hindi pwede, yung mga sharps rather, hindi naman pwedeng i-autoclave yan. So, anong gagawin? They need to first sanitize and disinfect it, and then ibababad nila sa mga sterilizing agent or sa mga solutions. Okay? By the way, on your disinfection, Kapag gumagamit tayo ng mga chlorine, no? Gumagamit tayo ng Zonrox, okay? The famous is Zonrox, okay, or your sodium hypochlorite or a bleach solution. You should always follow the procedure that's being that can be found in the label of those disinfecting agents. Okay? But in general, kapag ganito yung usual na ginagamit natin, 10%, no? 10% na bleach solution. Like for example, sa isang litrong tubig, no? Um, kailangan nating sa isang bote, no, na kung saan pwedeng mag-cash ang 1 litro, kailangan nating mag-add ng 900, okay, or ay 10 ml, no, a 10 ml of sodium hypochlorite in a liter of water. Okay? So, para at least merong sapat tayo na panlaban sa infection na yun. Okay? So, guidelines in maintaining clean environment. So, these are the guidelines in maintaining clean environment. So, take note, when in contact with body fluids, always do hand washing. Always wash your hands instead of using only alcohol-based hand rub. Because there are some pathogens that can be still transmitted in the body, no? Kapag body fluids yan. Okay, kaya importante pa rin na maghugas ng kamay, then use alcohol-based hand rub. Your alcohol-based hand rub would not always be enough. Mas effective pa rin kapag naghuhugas tayo, no? So, running water and a soap. So, hand washing is still the most effective than alcohol-based hand rub when caring for a patient with Clostridium difficile. Okay, ano pa? Observe cough etiquette, that is to prevent infection. Provide the patient or resident with their own personal care items and dispose them accordingly or as needed. That's to prevent the transmission of infection. Hindi mo palang i-share yung comb ng patient. You could not share their toothpaste, their toothbrush, or their soap. Dapat meron silang mga sariling personal care items. That is to prevent infection. Ano pa? Keep contamination or contaminated dirty items away from the uniform. Okay? That is to prevent the pathogens being transferred from your clothes. Another is pwede ka rin gumamit ng apron. Like for example, you change the patient's bed linen. Do not carry the soiled bed linen in close contact to your body. Kaya dapat at least merong space pa rin between the soiled linen sa iyong uniform para hindi madumihan, para hindi maging contaminated yung iyong uniform. Another, when cleaning, do not stir up the dust. Okay? So instead, use a damp cloth or wipe the area with the use of damp cloth or kaya imap mo na lang. Okay, lalong-lalo na kapag may mga babies doon. So, hindi ka pwedeng gumamit ng walis tingting, walis tambo. Okay, pansin mo kapag nagwawalis tayo, yung dust minsan is lumilipad, no? Especially kapag sobrang madaming dust. So, instead of using um, walis tingting or your walis tambo, no? We should first wipe, okay, the area with damp cloth, okay? So instead of using those cleaning tools, okay? So take note, your dust will always carry pathogens. Another, do not shake bed linens. Take note, the patient's bed linen, may mga microorganisms yan, may mga pathogens pa rin yan. Kasi yung skin natin, microscopically, nag-shed off ang mga skin natin. At pwedeng sa mga scales, no, sa microscopic sheddings, sa mga nag-shed na dead skin cells natin, no, andun siguro, no? Baka andun yung mga pathogens, yung mga bacteria. That's why you do not need to shake the bed linen. Bawal na bawal i-shake ang bed linen. Unlike sa bahay natin na medyo kumpul-kumpul na, no? Medyo hindi na maayos yung ating bed linen, ipampapampag mo lang and then fix it, okay na. Okay, but in patient, no? Sa home care, sa hospital, sa mga residents na sa mga resident area, hindi po pwede. Okay. Next, Dispose the garbage or trash properly. That's to prevent contamination or cross contamination. And maintain good personal hygiene because personal grooming or hygiene reduces the presence of microorganisms. So let's move down to the other form. So we have your surgical asepsis. So your surgical asepsis is used for procedures that involves entering a person's body such as surgical procedure, injections, insertion of IV fluids or IV catheters, and your insertion of urinary catheter. So take note, although this is already beyond this scope of practice as caregivers, okay? Pero still a must no na pag-aralan natin. So kapag mga operating room procedure, no? Kapag nag-insert ng swero o nag-insert ng sunda, they need to observe surgical asepsis. Okay? When you say surgical asepsis, dapat ay sterile yung area. When say sterile, those areas should be totally free from microorganisms. Okay? Maski 0.09%. No? Unlike sa safeguard natin, merong 99.9% effective, merong naiiwang 0.01 microorganism. Ibig sabihin nun, hindi yun surgical asepsis, hindi yun sterile kasi meron pa rin natira. Take note, when say surgical asepsis, dapat ay sterile, meaning totally free na walang microorganism. Okay, totally free na walang microorganism. Next, we have your barrier method. So, forms of your barrier method could be the use of gown, face mask, face shield, or protective eyewear. Sorry, nag-close yung aking slide. I will just share again. Okay, so next is the use of your protective barriers. So your personal protective equipment or your PPE, these are forms of your barriers that are being worn to physically prevent the microbes from reaching our body. Okay, so examples of your PPE could be your gloves, gowns, face masks, and your protective eyewear rather. Okay, so I think in the video the link of the videos I shared to you, andun yung mga techniques on how to at least wear, no, how to don on and don off, okay, donning and doffing personal protective equipment. Okay, so next, I think this is now the last, no, you have your isolation precaution. So aside from medical asepsis, surgical asepsis, the use of your protective barriers, importante din ang transmission-based precaution. So transmission-based precaution are used when a person is known or thought to have an infection that is transmitted, that it could be easily transmitted. So we have your airborne precaution, we have your droplet precaution, and many more. So your airborne precaution, okay, this involves placing the patient or a resident in a private room with closed door, no, and wearing a mask. And you need also to wear a mask when entering the room or when caring the patient. And you need to minimize the amount of time spending with the patient. And if so happen that the patient needs to move out, no, needs to go out from his or her private room, that patient needs to wear a mask. Okay? Bakit kailangan ng airborne precaution? Kasi yung infection ng patient na yun could be easily transmitted. No? Like for example, ano ba yung mga airborne pwedeng mapasa through airborne? You have your TB, meningitis, okay? Ano pa? Your TB or your forgot already. TB or your meningitis, no? Basic example, we have your TB. Those are your airborne. Okay? So actually, there's a difference. There is a quite similarity rather between your airborne and droplet. Kasi sa airborne yan, kapag yung TB patient umubo, no? Yung pag-ubo niya, merong sumasamang droplet yan that cannot be seen through the naked eye. And those droplet contains TB bacillus or your TB bacilli. And it is being suspended in the air. Andun lang siya sa surrounding. Andun lang siya sa loob. Okay? Kapag ikaw pumasok sa loob, wala kang face mask, no? Wala kang PPE, pwede kang ma-infect agad. Okay? So that's how airborne really works. Number two, droplet precaution. Okay? There are many, the experts are saying that the coronavirus or the COVID-19 is a droplet precaution. So droplet precaution are similar to airborne, except that it's usually only necessary to wear a mask when you are within the 3 feet, when you are within 3 feet away the infected person. Okay? So when say 3 feet, at least 1 meter, no? Kapag ikaw ay close contact with the patient, like for example, you are taking care with a patient with influenza, whooping cough, strep throat, meningitis, rubella, pneumonia, diphtheria, okay, or other forms of your highly infectious diseases, you always need to wear a mask, okay? Kasi kapag sila umubo, sumipon, no, yung mga droplet that contains bacteria or viruses is not suspended in the air, no, unless you are within less than 3 feet. Okay? But if you are more than 3 feet away, hindi yun mapupunta sa'yo. The problem lang is yung droplet niya mapupunta sa surrounding ng pasyente. Like for example, meron siyang cellphone, hinawakan mo yung phone niya, meron siyang utensil, hinawakan mo yung utensils niya, okay, andun na yung infection. Yung droplet na punta na dun sa malapit sa kanya. Malapit sa within 3 feet sa kanya. But those droplet cannot reach you if you are more than 1 meter away or more than 3 feet away from the patient. Okay? Next, we have your contact precaution. Your contact precaution are used when caring a patient with disease such as caused by pathogen that can be transmitted through direct contact or indirect contact. Okay? So, in those situations, we always need to wear personal protective equipment during patient contact and proper handling of surveillance. Number two, we have your standard precaution. Your standard precautions are used by the healthcare workers to prevent contact with bloodborne pathogens. So, examples of our standard precaution, proper use of gloves, no? Proper respiratory or cough etiquette. No, kapag tayo inuubo, sumisipon, huwag mong iubo, isipon sa harap ng pasyente mo, sa harap ng coworkers mo. Instead, you could use a tissue, no? You could use your handkerchief, you could use the sleeve of your uniform, no? Or your the inner aspect of your elbow, or pwede rin dito sa ating uh, kapag damit natin, kumbaga mag-cuff, okay, mag-cuff ka na lang, no, umubo ka na lang sa loob ng iyong damit, kumbaga, okay, para at least hindi siya ma-transmit sa ibang tao, hindi ma-infect yung ibang tao. Okay, other forms for standard precaution, we have your safe injection practices and infection control practices for lumbar puncture. Okay, so I think that's the end already of my discussion today. So kindly watch the different videos on infection control that I have uploaded in our Google Classroom. And please be reminded to please accomplish the different activities and submit them already because sooner or later mag-close na yung ating Google Classroom kasi mag-change na kami ng domain. So please um, accomplish those different activities. Okay? And please wait for further announcement for the announcement with regards to the activities related to this unit of competency. Again, we need again infection is or the spread of infection is highly manageable. Okay, kayang-kaya nating i-manage ang mga infectious disease na yun. We could easily prevent its transmission, its spread. Okay, as long as we are very cautious, no, in taking care of our patient. Okay, please do not forget your chain of infection, your moments of hand washing, and how to break the chain of infection. Okay? Again, I am Berkian Pugrad, your instructor. I hope to see you again on the succeeding sections of this unit of competency. Thank you very much.